In here. Hey everybody, thanks for joining. We're gonna give a few minutes as people's Zooms start firing up, and then we'll get started. Um, Thank you everybody for spending the night with us. This is gonna be awesome. As you guys are entering, would love for you guys to just drop in the chat who you are, where you're from, what school you're at, where your physical location is. It's always great to meet everybody. So if you have a second, hit that chat button and tell us a little bit about yourself, and where you're from. And we'll get started in a couple of seconds here as people log in. Oh, Abby is telling me that the host has disabled chat, which is probably my fault. Hold on one sec while I enable chat, if I can. Let's end here. Give me one sec. I'm just going to find where on this thing I can enable chat. If anybody has a quick Zoom expertise, let me know. Aha! I think I found it. Hey, guys, you should be able to chat. Drop us. Drop us where you are. Sorry about that. Drop us where you are. Would love to hear a little bit about you guys, and we'll get started in just about 10 seconds. We got somebody from BU out there. We have a Michigan, maybe UMich, Indiana, awesome. LA post-bac program sounds great. Well, why don't we get started because we're a couple minutes past the hour here. So welcome everybody. Thank you so much for joining us today. This is going to be awesome. I'm Dr. Mehta, and I have with me Dr. Vora, who I'll let introduce herself in a couple of seconds here. We wanted to talk a little bit today about international medical experience and medical school and the application process. For those of you guys that are out there, I think this is going to be a great way to learn a little bit more about how you can get involved, what you need to do for your application. And as I said, would love to learn more about you guys. So please keep dropping in the chat where you guys are from, who you are. You probably also saw the Q&A functionality, so feel free at any time to drop questions. We're going to do a Q&A at the end, so drop questions as you go so we can answer them. I did want to get a quick gauge of the audience, so I'm going to launch this quick poll just to understand who everybody is, and where everybody is in their respective journeys right now. It'd be great just to get a little understanding of that. Um, and then let's kick it off here. Awesome. So thanks guys for entering the information. I'll share the results here just so you guys know who your fellow audience members are. We have a smattering of pre-college and then freshmen, sophomore, juniors, even some people in post-college and some parents out there, which is great. This is going to have something for everybody as we go through it. So let me get started here. So, as I said, I'm Dr. Mehta. I'm the founder of Med School Coach. I'm also a vascular interventional radiologist at Harvard Med School and Beth Israel Deaconess Medical Center. I practice medicine and I help medical students get into med school. It's sort of what I'm passionate about. I'm also passionate about international travel. I've actually done a ton of international medical experiences, volunteer experiences, scholarship experiences in the past. I've spent months in Africa, in Botswana and Swaziland. At medical school, I started a remedy chapter, which was collecting used surgical donations. We went down to the Dominican Republic. I spent about 4 months in India, living at the Gandhi Ashram and actually volunteering for an organization called Manasadna. So international experience is something that I'm really passionate about, which is why I was so psyched to find Dr. Vora, who is the founder and CEO of Global Brigade. So I'll let her introduce herself right now so she can tell you a little bit about herself.
Great. Thanks so much, Dr. Mehta. As Dr. Mehta said, my name is Dr. Shital Vora, and just so excited to meet and hear and see the chat from all of you. Just similar to Dr. Mehta, I am just tremendously passionate about international travel and, on a broader scale, just making international impact in whichever way that we can. So as the founder of Global Brigades, we had founded the organization almost 20 years ago. We're in our 19th year. So many years of exciting stories and impact and, countries that we've worked in. And, Global Brigades is a sustainable development organization that works with university and high school students in making major changes within very rural areas in Central America, in West Africa, and then we also work with the refugee population in Greece. And so when we first started Global Brigades, we started off primarily as a medical relief organization, and we're going to talk about this a little bit later on, but we've then evolved into having a multidisciplinary approach in supporting communities with the many resources to break the cycle of poverty. And so our largest approach and our largest program is our medical program, which we're going to take a deep dive into today. And I'm based in Chicago. I have a chance to work with all of our countries internationally. And I graduated at Marquette University with my Doctor of Physical Therapy. And my full-time role is as a CEO of Global Brigades is just ensuring that we're making this world a better place in any way that we can with the support of students and other partners as well.
Awesome. Thanks, Sheetal. And, Dr. Vora is an incredibly impressive individual, and Global Brigades is an incredibly impressive organization. And I'm going to get into a little bit of why we wanted to help our students, you guys out there, sort of learn a little bit about them as I talk about what medical schools might look for, how you can improve your application, and maybe some of the things to look out for as well. And then I'll let Dr. Vora talk a little bit more about Global Brigades in general. And so that's sort of that's our itinerary for today. Again, just want to remind you guys, if you guys want to drop questions, please feel free. That's what we're here for. Use the Q&A function, use the chat function. The chat function is a little bit harder for us to find questions later on, so Q&A is better. If you're going to drop a question about international travel, being a doctor of physical therapy, being a physician, anything in between, drop us questions. We're here to answer them. We're here to talk to you guys as we go through the entire process, okay? So let me start with sort of the state of admissions. And for those of you guys who've maybe been on some of our previous webinars, you might even have seen this before, right? Medical school admissions obviously is tough. To be honest, PA school admissions is tough. Physical therapy school admission stuff, like the whole healthcare process is becoming harder and harder because we have more and more students who are interested in it, right? Since 2020, we had almost a 20% increase in the number of applicants to medical school, and the number of acceptances didn't go up any, right? Because the number of medical schools stays pretty stable the entire time through, or the number of seats in medical school stays fairly stable the entire time through. So it's an interesting dilemma out there as medical schools become more competitive. How do you as an applicant become more competitive? And also keep in mind that it is not just your GPA and MCAT, right? GPA and MCAT are super important, as you can see down here, right? You have to have a solid GPA, you have to have a solid MCAT score, but their increases since 2018 have actually not increased all that much. You would anticipate, hey, medical schools probably want people with fantastic GPAs, and because there's even more applicants, I got to get a higher GPA. And while that's somewhat true, the reality is it's not the whole truth by any means whatsoever. This average GPA and the average MCAT score has not budged since 2018. So what are medical schools looking for? They're really looking for and thinking about, hey, how do we get applicants who are well-rounded? How do we get applicants who are going to come into our school and be leaders in the field, be leaders in medicine, right? And so that's what we're going to hop on. Somebody just dropped thank you, Josh, for letting us know. Now the Q&A function is disabled. Dang it. I don't know how the Q&A function got disabled. Let me see if I can enable that real quick. Oh, Rich says it's working. Well, I appreciate it, Rich. Hopefully it does work. Okay, great. Let me move on. So, I just talked about how in the medical schools they're becoming more competitive, right? But they're not necessarily becoming more competitive just based on stats. They're becoming more competitive based on um, a whole bunch of factors, and specifically, it's like extracurriculars, right? It's core. AMC has actually developed what they call the core competencies. I don't know if you guys are familiar with it, but the core competencies are essentially a set of guidelines that has been put out by the AMC that fall into four different categories: interpersonal, intrapersonal, thinking and reasoning, and science. And they basically expect a student who is applying to medical school to have these competencies and demonstrate that they have these competencies on their application and through their activities. You can sort of break up these competencies, there's 15 of them, and I'll go through them into what I call nine soft ones and sort of six hard ones, right? The hard ones being the ones that are more science based, that sort of have there's one for basically science reasoning, right? That's your MCAT score or your GPA. But then there's a whole bunch of soft ones, right? Interpersonal skills, how you communicate with others. We're going to go over all those. But one thing that I really want to emphasize is how important these things are, because this is literally what the AMC, right, has put out for medical schools to say, hey, evaluate applicants based on these criteria, right? And as I've sat on medical school admissions committees, as I've interviewed students for residency and medical school and everything in between, I can tell you that we really do take these things into account, right? These are really things that we want to make sure that an applicant has, and it's the activities that an applicant does. It's not just saying, right? I don't want an applicant to say, I'm a really good leader. It doesn't make any difference to me. What I want to see is, have you shown me you're a really good leader? What are the things you've done in the past? What are your experiences that have proven that that's who you are? So let's go through some of these just so you guys have a familiarity with them. And the first are thinking and reasoning competencies, right? They break these down to critical thinking, quantitative reasoning, scientific inquiry, and written communication. Now, a lot of these are the harder skills, right? These are things that we can evaluate based on, hey, how is somebody's GPA? Have they done well on the MCAT? Have they participated in research experiences? How is their essay for a medical school, right? You can imagine how all these different things are factoring into that. And then there's science competencies, right? That's fairly obvious. It's at a medical school and or any really pre-health field. We need people to at least have some science competencies. It doesn't mean that you have to know all of genetics before you walk in there. It doesn't mean you have to know the anatomy of the entire body, but you do at least have to have some basis of what's going on here, right? And so that's one of the those are two of the things that schools are definitely going to look at. Before I go any further, actually, let me launch another quick poll for you guys, because I want to just understand where you guys are in the scientific competencies category and how familiar you guys feel or how confident you guys feel about that. So I'm just asking a question: have you guys taken the MCAT yet? Obviously, this is a very broad question. It's not necessarily relevant exactly to what we have to talk about today, but it does give you an idea that, hey, of course, the MCAT is one of the more important things in the medical school application process. And most of you guys actually out there have not taken it. So most of you guys, from a medical school admissions point of view, actually haven't even started demonstrating these two competencies, and that's totally okay. That's what you're going to do a little later on. But now let me get to some of the other competencies, some of the softer ones, right? Some of the ones that maybe are harder to quantify and sometimes harder to figure out as an applicant. How am I going to gain these experiences, right? And so there's this big category called interpersonal competencies. And what does that entail? Or what are the things that AMC has actually outlined that those entail? Well, one, service orientation. Your demonstrated desire to help other people. If you want to be a doctor, if you want to be a healthcare provider, you better want to help other people. That's fairly obvious, but how are you going to demonstrate that, right? Well, you're going to do observerships, but you're also going to have to sort of take an experience, right? You're going to have to do some clinical work. You're going to have to do volunteer work. You're going to have to do things that are in medicine and outside of medicine that demonstrate that you really want to help others. That's what you want to do on an everyday basis. Social skills, right? Your awareness of others' needs, goals, and feelings. How do you evaluate another person? How competent are you at talking to another person, understanding when somebody is maybe in need, and what are you doing to show your awareness and then act upon that? And then cultural competencies, right? Super important, particularly today, a knowledge of socioeconomic factors, right? And that could go from language to social upbringing to race and gender and sexual orientation. Are you somebody who is competent across the board with this? Do you understand it? Have you been exposed to these different areas? And if not, well, maybe you haven't shown this, right? If you're coming to me as a medical school applicant and you say, I have never left my little bubble of blank, then are you really demonstrating these social-cultural factors that might affect your future interactions and behaviors? Well, something to think about, right? Teamwork, a fairly obvious competency that obviously we want everybody to have. And then oral communication, right? The ability to explain yourself to others, the ability to talk to others, the ability to use language to communicate with others. And, sometimes oral communication also involves more than that, right? It involves sort of like physical communication. How empathetic are you with somebody? Do you follow the right cues? Are you able to talk to somebody and a patient in the right way? So these are some of the interpersonal skills and competencies that medical schools are looking for. And then there's intrapersonal. Who are you? Do you have an ethical responsibility to yourself? Are you reliable and dependable? Are you resilient and adaptive? And do you have a capacity for improvement, right? So take a look, like just look at all these things and ask yourself, hey, have I developed these skills? And if I have, awesome. How am I going to talk about it? How am I going to prove to an admissions committee, to a professor, to a physician that I actually have these things and that I can, demonstrate them? Because the reality is your med school application is not just doing these things. That's a huge portion of it, but then it's translating these things to paper and an interview and showing them, who you are. Another quick poll question for you guys. Now that we just went through those 4 competencies, which competency category do you feel like as an applicant, maybe you're lacking the most in? And obviously, this is a tough question for some of you, right? It's like, oh, I don't know, maybe I'm lacking in all of them. But just think about it for a second, right? As you're developing yourself, hey, what are these things that I have the most trouble with? What are the things that I think medical schools are going to not understand about me in the way that I want them to? And so here's some of what your peers are scared of, right? So it's across the board. Everybody's sort of almost equally scared. We're not quite 100%. Maybe all the results are in. Maybe we need a runoff, but we're close, right? And all these things being things that you guys are worried about. A lot of you are worried about science competencies. Again, I talked about the MCAT. By the way, if you need MCAT help or if you need some MCAT instruction and or apps and videos and free things, we'll actually I'll drop a few things in the chat for you guys to take a look at because they can be very helpful. But the intra and interpersonal skills and competencies, obviously something that you guys are also worried about, and to be honest, rightfully should be. And so as you're going through this, and of course we're here talking about international travel, a bunch of you guys are probably rightfully thinking, hey, a way for me to check off a bunch of these: service orientation, cultural competencies, teamwork, oral communication, social skills, ethical responsibility. Hell, I can show that I have reliance and adaptability. Maybe I'll go on one of these international trips, right? Maybe I'll go volunteer abroad, or obviously volunteering at home is obviously incredibly important too, and you should do that. But there are some more that you may be able to check off and demonstrate by going abroad. And you might be thinking, hey, that's an awesome opportunity for me. Let me go abroad, right? And in reality, it is. But I want to warn you that it's not just about sort of going on a medical trip and saying you went on a medical trip, right? You have to really you have to prove to me that you did this because you wanted to, because you actually helped the community, that you didn't just sort of cut a check for a plane ride and hop on and go somewhere, right? You got to and shadow a physician. You got to actually do a lot more than that. You have to become involved in the community. You have to develop stories and relationships with people. And so one thing I want to warn you guys about as you guys are thinking about, hey, should I get some international travel experience, is that there's some pitfalls in this. In fact, again, going back to AMC, they've actually put out guidelines for medical students and pre-meds providing patient care during clinical experiences abroad. So there are places that will even tell you, hey, like come and you'll get to do surgery, right? I don't think anybody's that extreme, or hopefully nobody's that extreme, but it's the equivalent of that. And you have to really be making sure that you're potentially, obviously, not doing harm or abuse in situations, and you really have to make sure that you're aligning yourself with an organization that that you can trust, and that at the end of the day, you're going to feel like, hey, I've made an impact in the community. This is something that I really enjoy doing, and I felt like, hey, I've really made, again, an impact in the community. I've done something that's important. I haven't just gone down there and gotten on a plane and come back. I want to just launch another quick question, because I want to get to know you guys a little better. Which is, have you guys previously participated in international medical work? And if you have, amazing. Drop us a chat and let us know what you've done. Would love to hear a little bit about it. Maybe we could talk about it a little bit after. Drop it in the Q&A, drop it in the chat, because I'm sure everybody's interested in kind of seeing what people have done out there in the past. And actually, a quarter of you guys have participated in things, which is amazing. So some useful thoughts as you are thinking about what kind of organization to align yourself with, or how you're going to get some of these experiences, right? Think about the primary objective of the organization. Think, are you a part of the solution, right? Is going down there actually a part of the solution? Are you going to have skill appropriate involvement? And are you doing stuff to just help the entire community? Is the organization doing stuff to help the entire community? Or is it just sort of, going down there for a day or a week and never seeing the community again? And I really think that this is an extremely important part. In my international travel and experiences, I told you guys I spent about 4 months living at the Gandhi Ashram in India. Well, medicine was only a tiny portion of what I did, because the reality is, you can't do advanced surgery in the middle of the slums in India. Of course you can't. The medicine that you're doing is oftentimes things as simple as sanitation, right? Like public health and building latrines. Like those can be some of the most impactful things that you can do in a community. And so a good organization is thinking holistically about how they can help the community. And so with that is why I wanted to bring in Dr. Vora and Global Brigades, because the reality is, of all the organizations I've seen, this is one of the really amazing ones that has done incredible work. And so I want to actually kick it over to Dr. Vora now to talk a little bit about what Global Brigades does, how they came to be, and what maybe the opportunities might be for you guys out there who are interested in participating. So, Shital, I'll let you share your screen, and I'll.
Excellent. All right. Just let me know when you guys can see my screen here. Good?
We are good. We can see your screen.
Okay, great. Excellent. All right. Well, so thanks so much, Sahil, for...
Just kidding. We could see your screen.
Okay, how's that?
There you go.
Okay, wonderful. Excellent. Well, again, thanks, Sahil, so much for, just that overview. And I think that, it's just so important to know, there's so many opportunities out there, and there's so much to think about, especially as all of you as pre-med students and really going down that journey of getting into medical school, and really how do I make myself a strong applicant? There's just so many opportunities. And while you want to do every single opportunity, while you want to jump in and try to be involved as much as you can, there are really critical things to think about in terms of not just being able to be a strong competitive applicant, but also what are you personally interested in? What is a part of the journey that you would like to participate in terms of the experiences that you'd like to have to really harness this entire process of being a strong applicant and a strong and competitive applicant. And so, as I shared earlier in my introduction, Medical Brigades is a incredible opportunity where it follows so many of these core competencies that Dr. Sahil had talked about. And also, one of the main things here is while you're really fulfilling a lot of the criteria and a lot of the experiences, and opening your mind and being able to see a lot of that critical thinking and all the other components, but you're also making true and tremendous impact in the world, right? And I think that those two things being coupled are just a wonderful harmony of being able to think about, okay, as I'm going through this process, as I'm opening up these opportunities for myself. This is also a transformational type of experience where I can do everything that I want to do to be a great applicant, but then I'm also learning a lot about myself. I'm learning a lot about the world, and I'm also, again, making that tremendous impact that is so necessary in this process. So a little bit of who we are. Our mission is to inspire, mobilize, and collaborate with communities to achieve their own health and economic goals. And so really what we do here is that we have an entire team in the countries that we work in, which we'll talk about in a minute. And we're an organization that's doing high impact sustainable development programs in these communities. And we're talking about, when we say the word community, we're talking about very rural communities in the countries that we work in. So they have very limited access, if at all any access, to basic needs, limited access to healthcare, limited access to water and sanitation, limited access to economic development opportunities. And so, what we are doing there is creating an opportunity to really break the cycle of poverty. And, we have our respective programs in which focus on different aspects to really create a multidisciplinary approach in breaking that cycle of poverty. And simply our vision is to have millions of empowered community members with the resources and capacity to thrive. So as we're, meeting community members and we're seeing and we're working in these countries, what we're seeing is that, everyone has the hope and the vision and the want to be able to be in a better place for their lives and for their future generations. But simply the resources are lacking. And so our organization is really there to help bridge a little bit of that gap, work with local partners, work with volunteers, work with all the, key components and partnerships necessary to be able to, make that gap a little bit more closed, and also, bring a higher quality of life for the individuals that are residing in these communities. And our pillars and our values are really focused on empowerment. So we're working with our community members. They're woven throughout the entire process. So just to be very frank, it's not a group of Americans or a group of Canadians that are coming into these countries. We're actually working with the community leaders. We see ourselves on the bottom, kind of seeing what the needs are and pushing those needs upwards, so the community members have that. And our holistic approach is, again, that multidisciplinary approach. It's great that we are doing, just medical. It's good that, we're able to build a water system in a community to have clean, drinkable water. But all of those things, many things need to come together within a community in order to really bring that quality of life upwards. Scalability and sustainability, those are such key words, and I'm sure all of you have heard that in some capacity. Scalability is being able to create a program that can reach many individuals with the highest impact possible, right? And then the sustainability is ensuring that once that impact is there, that it doesn't go away if the organization is not, doing work there, or right, or if there's no volunteers for whatever reason, such as a pandemic or something like that, right? The idea here is that the sustainability is really just is really focused on long-term, high-impact, future generations being able to have the benefits of what's happening over time. And then, again, some of our values are financial transparency, knowing that, all of our donations and all of the funding that's coming in is going straight to our programs in the community. And then the biggest thing is collaboration, is working alongside with other partners, whether it's local governments or community members themselves, volunteers, doctors, nurses, pharmacists, whoever is on the program, making sure that that collaboration is happening to achieve the best results at the end. So where we work in primarily in these three areas. We work in Central America. So the countries that we work in are Honduras, Guatemala, Panama, and Nicaragua. We also work in West Africa in the country of Ghana. And then we also have a program in Greece where we work with the refugee and migrant population in Greece. So we're focusing on really supporting a different audience in Greece. But our reach has always been working in countries that really need it, and also with the potential for great partnership, again, with along the lines with that collaboration. And a question that we always get is, okay, this is very interesting. I'm very interested in volunteering in these countries. I'm very interested in visiting and seeing what the healthcare system looks like there, or how can I make impact in these countries? And typically, the first question that we get is is it safe? Is it safe to go there? What does it look like? And, I just want to address that right away here is that, we are really positioning our programs and positioning all of our operations, not only to make sure that we're making the most impact in the communities that we partner with, but also that it is a safe place for everyone to go in. So all of our countries are registered with the Overseas Security Advisory Council. We also follow the IVPA, which is an acronym for the International Volunteer Programs Association standards. So this is kind of the overarching umbrella of many volunteer organizations that are high functioning and safe capacities. We follow their standards. And then also in terms of safety, we provide a lot of the insurance and things that are necessary for safe travel. So I know that if you're a student or a parent listening, those are things that we take very seriously and is really just embedded in a lot of our programming. So a little bit.
Can I ask you a quick
yes,
question?
please.
Because I found something really interesting there, which is you were talking about Greece and the fact that you were working with a refugee population, which I'm sure in sort of Central Europe and Eastern Europe has become potentially something that's even more acutely of need with the sort of global uncertainty and war and everything else that's going on there. Is that a relatively newer program that you guys are working with? Because I believe a lot of your original programs were in Central America.
Yes, it's relatively a newer program. We started our program in Greece with the refugee population in early 2019, towards end of 2018 when we started to visit, but 2019 is kind of the official launch of it. And yeah, absolutely. There was a need there. There is an entire migrant crisis that's happening, in the world in various different areas, and specifically in the Greece, with our Greece program, what we're focusing on is many migrants have arrived in Greece, trying to find a place to be safe and refuge, and their entire lives have been left behind. And so simple things like access to healthcare, right, is a little bit more of a challenge for them. Many of them have left their professions and left their livelihood to be able to, be safe for their families. And so our programs really focus on, a little bit different than our Central American and our Ghanaian programs, but the same lines of creating more resources and basic opportunities for, improved health, improved economic stability, clean water and sanitation for those that have left a situation that has been, unfortunately has been very tragic for them, and kind of starting from scratch. So it's a little bit of a different program in terms of the other, in comparison to the others, but nonetheless just as impacting, and if not, a little bit of a different lens of similar issues, but in a different setting.
Awesome. Thanks for that insight.
Sure. Great. And so, just a little bit of our history. I think everyone is always wondering, well, how long, you've been around for about almost 20 years, how did we start? And just like many of you that are listening today, we were a group of students at Marquette University that, were looking for international volunteer opportunities back in 2003. And, back then there wasn't much out there. There was Doctors Without Borders, but you had to be a licensed professional. There was Peace Corps, but you had to dedicate 2 years of time, which is certainly really hard if you're, on a pre-med track or any sort of a healthcare track to kind of pause for 2 years and do something like that. And so, very simply, we had gotten in touch with a group of physicians that had on an annual basis link up with a nonprofit in Honduras, and what they do is they provided medical treatment and did a mobile medical clinic in Honduras for several weeks, and it was kind of the closest thing that we could do in terms of an international volunteer opportunity given a short time frame. And that very first trip, just to paint the picture, we thought, okay, we would just be shadowing a little bit, we would be maybe lugging some, luggage and equipment and things. But, as undergrad students, as pre-med students, even as graduate students, we didn't think at that time that this experience would provide a lot of impact, not only on ourselves, but more importantly on the community. But when we were there for that 7-day visit in Honduras and shadowing doctors, working with the local Honduran physicians, working with community leaders, working with, local nonprofits, what we realized is that even just our presence of volunteering was incredibly transformational and impacting. We were able to be there supporting and seeing more and helping run the medical clinic in, in translating, in being able to shadow doctors and being able to support with some of the communication that was there. We were able to sit down and help with the local pharmacist fill prescription, of course, all under the supervision of a professional. And we were able to do health workshops where we were talking about the importance of washing hands and brushing teeth and the importance of general hygiene. As undergraduate and graduate students, we were able to make such a tremendous impact alongside with the professionals that we were shadowing. And, what we really wanted to see was, wow, this was such a transformational experience. But what was so incredible was that we got to learn a lot about ourselves, that we were all under this healthcare track, and we were able to see what international healthcare looked like. What does healthcare look like in a country that has very limited, if not any, resources, right? And then from, the patient, the person-to-person interaction, Sahil kind of mentioned this a little bit, is that, the interpersonal skills, right? How do you interact with others? How do you show empathy? How do you listen? How do you, the body language, the eye contact, all of these different things were things that would happen on that brigade. And really, we very quickly learned that this is such a key and important part of being a healthcare professional. And so, we had come back to campus and we tried to find organizations. And again, there wasn't much out there back at that time. So we took that leap of faith and decided to start our very own organization, which we had called Global Brigades. And, again, we thought it was just going to be something on campus. But over the course of a year or two, we would tell friends about this, and we would, talk about what we've experienced, and we would talk about the impact that was being made in these on these trips. And it slowly became a very interested and almost to some degree a very exciting type of opportunity for others to want to explore. And again, we've always embedded our programming with a lot of cultural sensitivity, with a tremendous amount of respect and poise with the countries that we work in, and that we wanted to really be resources for these communities and work alongside with some of the local partners that are really seeing this through. And so over time, as we realize is, this is great. We can do, our medical programs. We're there. We go for, 7 to 10 days. We're creating mobile medical clinics, which we're going to talk about in a little bit. And we're creating this access to healthcare. But what we realize is, that's wonderful. But there were so many roots of issues in these communities. And some of the roots of the issues were, there was a lot of lack of public health infrastructure, right? There was a lot of lack of clean water infrastructure. And so over time, we realized that in order to truly break the cycle of poverty, we really need to bring in some other aspects of programming, in which, we need to bring a water program, we need to bring in a public health program, and other programs to really supplement really making these communities thrive through addressing these issues from a multidisciplinary approach. And that's really what we have now coined is our holistic model. So our holistic model is really meeting our community's health and economic goals through various ways here. So, we do have a water and sanitation infrastructure, we have an economic development infrastructure, but our really big keystone here is our sustainable health infrastructure. And it's really creating a community ownership and collaborating with community leaders in making sure that this multidisciplinary approach is truly how change happens in the community. And again, what we see ourselves as resources within the community, and the community leaders are really the ones that are propelling and being empowered to make this happen within their community. So what's been exciting is that this relationship of all of these different components has been the way that our communities have been really thriving and have been, again, breaking that cycle of poverty over the last few years. And be able to say that over time, right, that sustainability piece is so key, that it's not just that, for 6 months this works. What our programs is really focusing on is that this is working not just now, but over many, 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 many years with future generations to come. And so the way that this happens is that we have staff in country, experts on the ground, doctors and healthcare professionals and water and sanitation professionals and economic development professionals that are there who are really 365 days a year working with the community leaders on this, and the student volunteers are really plugged in a 1 to 3 week process of being able to participate in that entire process. So I just want to mention that, we've been working with so many communities. We're working in over 300 communities, in all of the countries that we work in. And we're working within the lens of the United Nations Sustainable Development Goals, in which, access to healthcare, access to water and sanitation infrastructure, economic opportunities, which weaves in, gender equality, reducing inequalities for individuals, right? Having opportunities for education in these communities. So, we're really just focusing on things that work. And, the United Nations has an incredible campaign in which we've developed our goals around to really kind of harness that sustainability piece. And so, the way that this works is, so you guys have gotten like a really good an orientation of what we do as an organization. And so how does a volunteer plug into this? So what we do is we coordinate a skill-based 1 to 3 week volunteer program, and also not just in-person program where you're physically going into these countries and, visiting these communities, but we also have developed out a virtual program, which has tremendous impact. And you're actually zooming in with the community leaders, with facilitators in all of the countries that we work in. And, those that have met a fundraising goal are able to participate in that 1 to 3 week volunteer program. So this is what we call our brigades, right? And so you're able to actually go down in country or virtually participate in building their health system and supporting the health system there, right? And you can do this by either joining an existing chapter if you have one on your campus, but more importantly, you can start a chapter if you haven't had a chapter on your campus. Or if there's a small group of you that would like to participate, that's certainly something that can happen. And so again, we've talked about some of our programs. We have a very strong medical program where we're actually going into, creating mobile medical clinics. We're providing dental care with our dental programs, and then public health brigades is focusing on public health infrastructure within the community that's needed. We're going to go into a little bit of detail in a minute there. So our medical programs here is pretty exciting. We've been doing this on a virtual level and certainly on an in-person level. So we're actually implementing a mobile medical clinic in rural communities. So we're bringing in medication, we're bringing in doctors and volunteers, and we're setting up shop in a local school or a local church or whatever the infrastructure is, and creating a clinic for the day and for several days to have every patient being seen. So the volunteers, you as a volunteer would be having the opportunity to assist in triage. So being able to learn about how to take vital signs. Again, all of this is done under the supervision of a healthcare professional. You're also shadowing doctors, which is such a key component. And then also working along with the pharmacist in filling prescription, and also facilitating health education workshops. So as I mentioned earlier, washing hands, the importance of oral health, the importance of basic hygiene and sanitation, of why that's important in the health world. And so in addition, what's unique about our organization is that our full-time local team that is in Honduras, right, that is in Guatemala, they are supporting from the sustainability piece in training community health workers. And also, if there's a patient that is unable to be treated on that brigade, what they're doing is supporting them with the patient referral program so that they can get the care that they need outside of the medical brigade at that particular day through an entire different process, right? So that nobody is left hanging. And I think that that's really important in the sense of, there's a sustainable piece and there's the volunteer piece that you'd be directly a part of. So again, you're being plugged into this larger picture of programming that's happening and really changing the access to healthcare within these communities and changing what is available to these communities in terms of that. And you can see in some of these pictures, again, you're really working alongside with healthcare professionals and having a lot of that piece of shadowing and clinical work and volunteer piece that is so important in being a strong medical school candidate. And this is just a basic itinerary, and you can kind of see that there's a lot of time in the communities. There is a lot of orientation. There is a lot of preparation of materials so that you feel very well equipped to be able to make the most of your volunteer experience. And what's exciting is there's also a lot of reflection, and there's a lot of learning that's happening. And so Dr. Sahil talked a lot about earlier is some of that critical thinking piece, that is all embedded in this process. So it's not just, going on a plane and, going to visit a community. There's an entire process of learning and critical thinking and interaction that's happening and leadership that's happening within this experience. And so, just one of the questions that we always get is, what does this mean, right? How can I do this? And so really, I wanted to share this is that, if you would like to start a chapter, the more individuals that you can recruit to be a part of your chapter, the lower your donation goal is, right? So really everyone is fundraising for their donation goal to come in country and participate on the Medical Brigade, and also and fundraise for their airfare. And what's happening here is, the more individuals that you recruit, the lower the donation goal is. And so, the entire process is being able to have as many volunteers to come onto the brigade as possible. And simply because the more volunteers that we have, the more impact that's being made, right? And so we would connect you with a program associate that would take you through that process of how do I recruit students? How do I get individuals to know about this? All of that our program associates support with. But I just wanted to address that because that is such a major question that everyone has in terms of wanting to do something like this and in their extracurricular and traveling abroad experience. And I touched a little bit on this. So we also have our Dental Brigades program. So, again, such a incredible healthcare track. And our Dental Brigade program really implements, similar to our Medical Brigades, a mobile clinic in these rural communities that are receiving actual dental treatment. So they're doing extractions, they're doing cleanings, and these are all dentists doing it. The students are shadowing and they're really learning and facilitating from a volunteer standpoint. But they are supporting also health education workshops. So a lot of these workshops focus on how do you clean your teeth properly, right? How do you brush your teeth in the best way possible? And so all of these things are really interacting with individuals within the communities to ensure that proper dental care is happening. But also, from even if you're a pre-med student and not necessarily a dental student, all of this is all falls into the same bucket. In order to have incredible health and have strong health, you have to have a multidisciplinary approach. So that also this program is incredible in terms of being able to have a different lens of healthcare, right? Specifically focusing on oral healthcare. And then I touched also on this is our public health brigades is such an incredible experience as well in terms of bringing public health infrastructure into the rural communities. So what we're actually doing is that we are building home infrastructure within the communities, family by family. So some of the projects that are being built are eco stoves, are latrines, so there's proper human waste that's being managed, showers, obviously, having a safe and clean place to bathe, that also contributes to your health, and also water storage units. Having a place to have clean water stored can also contribute to your health. So our public health brigades really focuses on improving health and hygiene and sanitation within the communities. And you'll see here in this picture is that you're working directly with on a family by family level and physically constructing some of these infrastructure, but then also doing a similar to some of the other workshops is doing explaining and teaching and educating community members alongside with the local professionals on the importance of public health. And again, working alongside with our community leaders in this particular brigade, we're working with the Basic Sanitation Committee, who are really in charge of that aspect of the community, and you're working alongside with them to ensure that this is something that is strong within the community and also important within their entire health system. So, we kind of talked a little bit about this, why is this important? Why is, volunteering abroad for pre-meds important? Why is this attractive? Why is this such a, exciting thing as a pre-med student that is aspiring to, get into medical school? So what we check off in terms of our program is clinical work, right? We know that for all applicants that are applying to medical school, clinical work is something that is absolutely required, or something that is great to have on your application, right? And so, with the Medical Brigades programs, you have direct interaction with patients, right? You have hands-on involvement with the, with patient interaction and other healthcare professionals. And, you're also developing the comfort of working with patients, right? Whether it's simply asking them how their day was, or simply, asking them, what are your symptoms, if you're translating for a physician. That ability to connect and form trustful relationships is certainly something that you're experiencing within the Medical Brigade. Another area here is shadowing. That is a majority of the Medical Brigade, right? You're actually observing a physician that is working and figuring out the diagnosis of a patient, and that's caring for and treating the patient, and you're getting to see what is the body language, what is the interaction, what is the bedside manner, right? And you're also then having an in-depth exposure to various types of practice, which is also important, right? What does pediatrics look like? What does women's health look like? What does geriatric medicine look like? And again, similar to the clinical work, you're forming relationships and you're exploring different areas of medicine that will help you formulate what type of track you'd like to go on. In terms of leadership, being a leader on a medical brigade, if you're starting a chapter, that is a position of responsibility that is so key when it comes to being a strong medical school applicant, right? So you're, as a physician, you're going to be a leader, right? You're being a leader for your patients, you're being a leader in the clinic that you're working in, and being a part of this program shows a lot of initiative. It teaches you how to manage, and it teaches you how to effectively lead others, especially if you're a chapter president. And lastly, in terms of volunteering, I think that's pretty self-explanatory, right? As a volunteer, you're showing that you're interested in taking time to support other organizations and support other opportunities. You're taking the time to, as in that track, right, being able to give some time of yourself in other opportunities here. So it's certainly clear in terms of the programs that we offer. We're really kind of checking off a lot of those boxes, but more importantly, right, we're creating these opportunities where it's a really transformational experience for you. And, again, being able to have an opportunity to think about where can I get all of these experiences, kind of a one-stop shop, right? And so I'll pause there if there's any, if Sahil, if there's any questions or anything you want me to focus on. I think we can kind of go through some of these questions in the Q&A. But, we're just so excited to be able to share some of these opportunities with you and hope that, all of these opportunities really kind of encompass what you're looking for in terms of, traveling abroad and creating more experiences for yourself.
For sure. Thanks. I mean, I want to just pause for a sec because it's easy to glance over the tremendous impact that a couple of students, people starting, way back in the day, 20 years ago, it was just a couple of students who started a group and went down there, and the incredible impact that you guys have made over the course of the last 20 years is just I mean, it's awesome. It's amazing to see, and it should be inspiring for everybody who's out there who's a who's a undergrad student, right, or just graduated college, and it's like, hey, what can I do? Well, you can do a lot actually, and there's a lot of change that can be made, and there's a lot of things that you can do to impact in reality the world. I did drop a link for anybody who was interested, and we have a couple links later on. If you are interested in getting involved, in fact, maybe I'll throw out that question right now, just because I want to make sure that we have the opportunity to take a look at this, which is, are you potentially, after hearing all this, like, are you potentially interested? Is this something that you'd be interested in? Because it really can be a fantastic opportunity for you guys who are out there to become involved. I had a chance to visit a brigade myself just to understand a little bit more about it. And it was awesome, right? I got to meet, I think it was about 50 nursing students who are actually on the brigade, plus a group from one of the UC schools who were down there. And it was really an incredible experience. Everybody was having the opportunity to actually be down there, actually work in the pharmacy, shadow shadow the dentist. The dentist is actually probably the most fascinating part for a lot of students, is they're like, "Hey, is that tooth really going to come out? Like, how is that going to happen?" It was very cool to see, and it was really great to it was really great for people to really be involved in it, and it's something that I think everybody out there. Who's chatting right now or sort of in the room should be thinking about in some way. Obviously, international experience is not the be all and end all. You can get incredible experiences in the United States, and in fact, you should. There are plenty of communities right here at home that need a tremendous amount of upliftment, as we're well aware of. But I think Global Medical Brigades is just a fantastic organization that allows students to, I don't want to say easily get involved, because nothing's easy about this. There's a lot of work that goes into it, but it is something that's already set up. It's something that you can sort of get involved with. There's a formula here. I think, Sheetal, you tell me, you guys have probably taken thousands of students on trips, and thousands of students have gone on trips and raised money for brigades up until this point, right?
Yeah, I mean, we've had almost, over, 90,000 students participate in our programs. And,
Ninety
you
thousand
know,
students. That's incredible.
yeah, and a majority of them, again, have been pre-med students. And what's been so incredible, at least from my perspective, is, seeing a student, like many of you are listening in today, as a pre-med, saying, hey, I'm kind of interested in this. They go on their first brigade, and, now they're practicing, physicians and practicing healthcare professionals. And they really think about, and they still remember, gosh, like that was the experience, or that was such a powerful experience, and who I am today, and the type of healthcare professional I wanted to be. And so, I think that's also, just a lot of it is that we're certainly creating a lot of experiences, and checking a lot of boxes when it comes to the things that you need to be, a strong candidate. But you're also learning a tremendous amount about yourself. But, again, while you're making incredible global impact. And I think that is very unique. And it's, we're seeing over the last, 20 years where, people are really remembering those experiences now as practicing healthcare professionals, as such a shift in their mindset, and a time that they really cherished a lot.
Awesome. That's great. So we only have a couple minutes for questions, because this was so awesome. One of the questions actually was about the MCAT resources that I mentioned. I forgot to drop in the chat, so I'm just going to drop it right now for you guys. So you guys, anybody who hasn't taken the MCAT, feel free to check out a lot of those free resources. They're really great for those of you guys who are going to be studying. Who I know it's a lot of you. There were a couple of questions, Sheetal, about some of the trips that I wanted to run by you,
Sure.
which maybe you could answer. One of the questions that's somebody out there asked is like, hey, if we already have some medical training, let's say I'm a paramedic, you know, am I going to get to do, how am I going to be utilized in the communities during these trips? Is there something more I could do? Would be interested to see what you guys have done in the past with that.
That's a great question. So each country, has certain restrictions or certain requirements in order to, if you are a healthcare professional, you would have to submit licensing and things to be able to appropriately exercise some of those expertise or some of those, some of what you practice here in the States. So it all just kind of depends on each country. If at the minimum, there's a lot of shadowing. Again, there's a lot of interaction and leadership that's happening along with the healthcare professionals. And, once you connect with our program associate, we can talk a little bit about what that would look like if you were, a trained individual, what some of the, requirements are to be able to do some of that on the brigade. But majority of it is, again, in terms of cultural sensitivity and in terms of, the legal requirements of these brigades, we want to make sure that we, again, as Sahil mentioned earlier, that we're really following what's appropriate and following what's comfortable within the standards of each country. So that's something that we can talk through with you if you have some formal training or certifications to be able to support with.
There's another question out there that I can answer. There's a question: is this only open for graduate students, or is this open to undergraduate students? And um, I think it's both, right? I mean, I know obviously you primarily focus on undergrads, actually, not grad students, but would love to hear your what you guys have done.
Yes, anybody can participate. Graduate students, undergraduate students, healthcare professionals. I know there's a couple of parents on the webinar. If you want to join your student, everybody can participate in our program. So there is, we have a variety of different folks that jump on board, and our programs are very much, again, open and capable for everyone to have the best experience possible while making the most impact. So majority of our volunteers have been undergrad, but we certainly have a good amount of graduate groups as well, and also other groups in addition to that.
Yeah, that's awesome. As I said, sort of when I was down on the brigade myself, and I saw a nursing college actually there,
Yep.
which I thought was super cool, for them to be down there. Obviously, they were sort of being trained as nurses in school, and then utilizing that in real life, and helping the community, which is really awesome to see. So we are on the top of the hour, which is usually when we sort of take a pause on this. It has really been great to talk to all of you guys who are out there. I can't thank you guys enough for participating. I if there's a bunch of links that we've dropped in the chat, if you guys haven't gotten those links or need any more, we'll send an email to you right after this, just to give you the recording of the webinar, so you can watch it again, so you can share with friends. But for those of you who are interested, if you go on medicalbrigades.org, and click the little button on top that says get involved, you can definitely get involved in one way or another. I would encourage it for those of you who are thinking through your own medical school or graduate school applications in any way. This is only going to be a great experience, honestly, for the application, but more so for yourself. For those of you guys who haven't done international experiences, as I sort of mentioned earlier, this is something that I'm very passionate about. It's something that certainly changed me as I went through my undergrad, graduate, and beyond. It changes how I approach patients today. Sheetal and I were talking about this a couple of months ago, because I think it obviously did the same for her as well. I mean, so much so that she started an international organization that's helped millions of people at this point. And so I think you can, I think going on some of these experiences is really, really impactful. Even if it's a week, even if it's 2 weeks, it helps you regain and restructure what you're thinking about in a way that you probably haven't had an opportunity to. So I think it's great for a medical school application. It's great for the community. It's great for yourself, is sort of how I typically position it. So thank you everybody for joining. Can't thank you guys enough. We hope to see you guys on a brigade for for anybody who has questions, feel free to email us. You can go to medschoolcoach.com for the med school coach side, and medicalbrigades.org for the Global Medical Brigade side. And we hope to see you guys soon. If there's any other questions, feel free to email us. Drop questions to us at any time. We'd love to chat with you some more. Dr. Vora, thank you so much for joining us, and thank you so much for sort of explaining the journey that you went on. Again, like incredibly impressive what you guys have been able to accomplish.
Great. Well, thank you so much for having this webinar, and also just excited to see all of you show your interest, and please feel free to get in touch with this QR code, and you can scan this and get in touch with any of our team members to get started on your next medical brigade here. So thank you so much for having me.
All right. Thanks, guys. Have a great one, and hopefully I'll see you guys soon. Take care, everybody.